Nice and squishy crunchy.
Welcome to the office.
Hey, Louisa.
Hey, Doctor.
Nice to meet you.
Nice meeting you.
Welcome to the office. So, what brings you here? What's going on?
The main problem is upper body pain.
Upper body pain. Started when?
I cannot even describe, maybe 10 years.
Okay, did something happen? Car accident? Slip, fall, life?
I cannot say.
10 years ago you started getting upper back pain.
Yeah, maybe more than 10.
Okay.
Mhm.
And what does that mean to you though, when you're saying upper back pain?
It's like, basically, it's like this part is the most, like, severe pain comes from here.
Behind the shoulder?
Yeah, like here,
So,
like a knife.
so the shoulder
knife
blade,
stabbing.
the whole shoulder blade?
Yeah.
Okay.
It comes to my neck, my jaw, my head, and I cannot even put my head into the pillow.
So it started on the right side,
Mhm.
on the shoulder, on the scapula shoulder blade.
Mhm.
It went up into your shoulder, neck, into the head.
Head, like ear
And the
area
jaw.
and jaw, and here too. Like when I touch it here, it feels like spasms type of.
Okay.
And then after a couple of years of having this pain, it started the left side.
Okay.
So basically, I have whole upper body, the same pain with hands, everywhere.
Pain, numb, tingle, what?
Most of the time, it's a severe stabbing pain.
Okay. And it's the whole part, or is it shooting and traveling?
It starts in one spot, as I said.
Always
it's
starts
once-
there.
Always starts here.
Okay.
And the most like severe pain, it starts like here. It's like this.
Okay.
And just travels like through everywhere, like lower, it shoots to my legs, like foot, like here.
Okay. Have you seen anyone for this?
I've been seeing a couple of chiropractors. I did adjustment. They did MRI. They said nothing wrong with my neck.
Okay.
My doctor thought I have a neck problem,
Okay.
maybe hernia or something. They did the MRI. They did a couple of X-ray. They said like nothing wrong. It's just some type of like spasm and stuff in my muscles.
Muscle spasms.
Yeah.
Okay, so there was nothing found on imaging, on X-ray or MRI.
No.
Okay, and did they give you any? So you had some treatment.
I've been having acupuncture.
Okay.
That helped though. It's temporary.
Okay.
The chiropractor I did a couple of times, maybe like 10, 15 times.
Okay.
But in my opinion, it was like temporary relief, 1, 2, 3 days, and then after that, when I did something wrong, like movement, like heavy lifting or anything, it started again.
Were you told what your problem is? Do you understand what your issue is? Why do you have this?
No.
No. Any other issues going on? Digestion, gallbladder? Have you had, you do your physicals every year?
Yeah.
Okay, everything is clean bill of health for the most part?
Mm-hmm.
Okay, so it's just figuring out why do we have stabbing pain in the shoulder that's going up and down and switching sides?
Mm-hmm.
Okay.
Jaw area, it got worse this
Okay.
2 years, 3 years maybe.
Right side or left side?
I think both sides it hurts because I cannot even put my face in my pillow. Both sides.
Okay, so how do you sleep right now?
On my back.
Which is the best way to sleep, by the way?
Really?
Yes. Number one sleeping position on your back. For you, I would say a small pillow and 2 pillows under your knees. That's ideal. If you're a side sleeper, we want enough pillow between the knees and on the side. But for right now, since the jaw is hurting, it's not a bad thing that you're sleeping on your back. It's a blessing.
Okay.
So I want
I'm
you
trying
to,
to get used to that.
I want you to please let your body get used to sleeping on your back. Just put 2 pillows under your knees. It'll make it easier for you.
Okay.
Okay?
Mm-hmm.
You ready to get started?
I am.
Okay. This is looking at you from the back. 24 bones that move here. This is the foundation of your 24-story building. What you're complaining about is around the 15th floor. okay? Around the 12th, 15th floor up in here, and all of this up in here. I want you to see that there's a slight kink going on here in your neck, okay, in your upper back and neck. But what I'm going to show you today is this curvature here that is causing these ligaments on the right side to be short. That's why they feel tight. I'm sure you've gotten massage. I'm sure you felt good. It went right back to what it was, though, correct? It's because these ligaments are short. You've had this for a while. And this is coming from this, the foundation. We're slightly off a little bit, okay? Do you see the slight imbalance going on in your foundation? You can see we're tilted a little bit. Yes?
Yes.
Let me go to the numbers. This will make a lot of sense. And we also are going to give you some answers today, okay? And this is the most important thing. You have a left rotated pelvis, PI4EX7, and you have a rotated sacrum on the right side. You have a short leg on the right. It's a 5 millimeter measured difference. And I'm going to give you your answer. If we work on your left pelvis, the hip will be 9 millimeters. It gets worse. So the answer was not your pelvis. And I'm showing you here. Let's look at it closer here. Look at my hands here. So the left pelvis goes down and turns out. The sacrum on the right goes back and down. So the overall effect is what? Your body is favoring to the right side. Does that make sense?
Yeah.
Okay. Now let's zoom out just a little bit. Actually, let's go here. And if the body is favoring the right side, we can see it slightly shifts to the right side. It's a very subtle shift. It's not so bad, but it's enough to where it caused a compensation. You see it goes like this to the right, and then it comes back left, and then it goes right again. And then what happens at your mid-back, which is where you're complaining of? The shift is happening here. So this upper back area here, look from here, okay? This is curved like this, which is compensating from here. And this is coming from down here. We have a right sacrum, and we have a left pelvis. I would not be starting on your left pelvis. We may have to address that later. Right now, the fix for you is going to be in your tailbone, your sacrum. That's number one. Whatever else I find, I'll deal with. But I'm going to show you, just working on your foundation, how it's going to change your mid-back and your neck. Okay? We have the right sacrum. It's dropped slightly on the right side, so we need to torque it up. Okay? And let's look at your side profile. Let me give you some good news here. Your discs are good. Your 5 is good, 4 is good, 3 is good, 2 is good, 1 is good. Your discs are all good there. But why do I also have upper shoulder pain? Why do I get tightness across here if I sit or stand? And the reason why is your posture. Because the foundation is off, when we run the posture line, we're running it from L5 all the way up. This line should be going through C2 and C7. And it doesn't. And what it tells us is your upper body you carry behind your foundation. So these muscles are working overtime just to hold you up. So I know you got it across here. Okay? We fix here, this gets better. Kalas, okay? Ready?
Ready.
All right. Questions so far?
No, I just want to get rid of this pain.
But do you understand so far what
Yeah.
okay, that's key. Now let's look at your neck. Now, yeah, you have some old injury here. 2 is good, 3 is good, 4 is good, 5 is wearing out. This is like a 30, 35-year-old injury. That's an old injury. And they're both kind of going together. So whatever happened there will also affect the shoulder. So we have foundation, we have mid-back. This mid-back area is also responsible for whatever's going on with the digestion. And then we have up here that controls the shoulder. So we got 3 things. Now, let's do the extension. When you extend back, it hurts your neck, right? When you look up,
I cannot even do it.
you don't, because it's pinching in the back. Here, I want you to see this. So look right over here. When you go into extension, 2, 3, 4, C5 starts to pinch on the back there. Let's see what happens in flexion. Now watch, in flexion, it's not really moving, is it? So when we look in flexion, there's no movement. This is still tilting back, yes? This one is still level. So your issue is 2, 3, 4, 5. C6 was the initial issue. You can see some whiplash injury you had, so whatever it was. Okay, go ahead and walk for us, please. Go walk towards the corner. And just your regular walk, okay? Back and forth 3 or 4 times. Just regular walk. Do you swing your arms when you walk? You don't swing your arms when you walk? Okay, keep walking. She got that side hustle. You walk like this, side to side. Keep walking, please. Keep walking. Watch, when she's walking, she doesn't actually go through her dimples. When she's walking, she's going like this. It's turning like this to the right side. Keep walking, please. You see, so it shifts to the left and then it goes to the right. So you walk like this when you walk. Your dimples and your hips should be moving up and down when you walk. This is important. So it's a side to side almost gait. Have a seat. Let's get started. All right. Starting at the base of the neck, let's see what we got. And the first thing we're getting is 8 points, C6, left side. $15 points, C1, right side. $10 points, T6, T7, left side. More T7. Oh, madam. And down low in the tailbone. $8 points, S2, right side. So S2, T7, C6, C1. 4 spots I'm getting, okay? Open and close, please. Open and close. Right side only, please. Do the right side only. When she does the right, the left wants to shift with it. Do the left side only. This is interesting. So when she does the left is moving, but the right isn't moving from the sacrum here. Do the right side only. When she does the right, the pelvis moves with it, but the sacrum is independent. Scoot back for me, please. Running my fingers down the spine right to when I get about there. We start to get the edema and pooling edema. Right there. 7. 1, 2, 3, 4, 5, 6. Tender.
Yeah.
More tender at 6, more tender at 7. 7. 7. Let's check the sacrum. Back slowly towards me, please. L5, S1, S2. More tender there. More tender there.
Right side. Yeah.
Right there. Top of the joint more or right there?
I think top.
Okay. Right there. There it is. It's S1, between S1 and S2 on the right side. T7. And now let's check the neck. Sit back for me, please. Sit back. 7, 6, 5, 4, 3, 2. Bend right. Bend left. It's all kind of stuck up there. Turn to the left. Turn to the right. More pain when you go right. Turn to the left. Turn to the left, turn to the right. Okay, so she's more restricted on the right. Look down. This is isolating the upper cervical spine. Turn left. Pain.
Mm-hmm.
So it's the left side upper cervical. Look up. Turn left. Turn right.
Mm-hmm.
Yeah. More on the lower, more pain when you look up or down?
Up.
Up, okay. So C6. So we're going to work on 3 things today. We're going to work on C6, T7, and sacrum. Okay?
Mm-hmm.
Now, before I'm going to start on your foundation, okay, ma'am?
Yes.
And then you're going to tell me what's different. T7 and T176. Now what's interesting on 6 here is you can actually see it better here. She has some lipping, okay, of C6. And that's where my arrow is. So you can see the disc is a little bit thinner there, and there's lipping of the vertebrae, almost binding. So this is going to require a bigger lift. We're going to have to really lift that segment C6. And if we don't lift it, it's just going to jam. So what's happening here is there's lipping of that C6 or C5 on C6. Let's look at this a little closer. This is T1, C7, C6. Give me 1 second here. Let's do it this way. This is T1, 7, 6, 5. So this is actually 5. So 5 is lipping. We're working on 6 as a PLS. 5 is lipping, so it's kind of going with it now. It's kind of stuck. Okay. We need to get motion in this neck. And there's going to be some basic things I need you to do, okay?
Mm-hmm.
You do those things, you keep your mobility, you get your result.
Mm-hmm.
You ready?
Yeah.
Okay, this one up. Let's start. Let's go start on your sacrum, please. We're going to go on the gray table. So we're doing the sacrum rotated, and we need to torque it up. Slide up some more, please. There you go. Let's center on the table. Good. I'm slightly on that right side, S1, S2. And we need to torque up. You okay there? Bear with me. Home run. Gotcha. 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 I got you. That was spicy.
Breathe.
Hello? You
Yes.
okay? It was deep, I know. Hold my hand, please.
Yes.
Please, hold my hand. Take your time. Hold my hand.
I feel a lot of this type of pain, but this was like, wow.
March in, please. March in, please. That thing was stuck, man. You're holding a lot of stuff. Let it go. Let it go.
That makes all these things happen.
Walk. Let it out. Deep breathing and walk. Deep breathing and walk, please. Deep breathing and walk. I'm just getting started, Louisa.
I know.
Okay, keep breathing, breathe and walk. Just walk, please. That was a deep set.
I knew this is coming up, but in the end,
What?
I knew this pain is gonna come up, so I was ready.
What pain? The spiciness?
Spicy and bitter and
Spicy and bitter and salty and all that?
and sour.
All those flavors, huh?
Okay.
That's a new one. I normally say spicy. You added the bitter today. Somebody got some stuff to let out, huh?
Yeah.
All right, keep walking.
Wow.
Knocked the wind out of you, didn't I? But as you're doing that, have a seat and tell me, how's the mid-back feel? And let's turn the neck, watch. Have a seat, check this out. I'm gonna continue, but I wanna see something. Sit straight. And the first thing is look to the left. Look to the right. Look up and left. Hold on, take your time. Up and left. Up and right. Different?
Much different.
I didn't touch the neck yet. Head down. Down and left. Different?
It's not severe.
Not bad, right? So what I was showing you today, we're still dealing with the mid-back and the neck. But all of this started where?
The foundation.
Yes, ma'am. Let's see if anything changed. 6 is still there. 1 is gone. 6 is still there, we'll deal with it. 7 is there, but less. Okay, let's go do T7. And the way we're going to do T7, we're going to do it as a...
Wow.
Hi.
I can't believe this is much like less pain right now. This
Wait.
one is gone.
You had it for how many years?
More than 10 for sure.
And it's not there right now?
It's kind of like now. I had it this morning.
Stand up and walk fast now. Walk fast before we continue. Come on. There you go. Come on, faster. Come on, you go on faster. Turn around. Let me tuck the gown in. Come on, walk faster. Ah,
Now I feel like I'm walking.
better. One more time and then let's go down. There you
I
go.
feel the movement in here.
You got the movement in your hips back.
Yeah.
Louisa got a groove back. Yes. Let's go face down, please. 1, 2, 3, 4, 5, 6, 7. Oh, nice and squishy, crunchy.
This feels good.
Nice. I think it's a little different than what you got before, yeah? Walk it up. And breathe.
Easy.
Have a seat. Okay?
Yeah.
Okay?
Actually, I can breathe.
Deep breath. Take a deep.
I
That's
had
it.
a shortness of breath all the time. Congestion. I felt like I'm having a health issue here.
Look to the left. Look to the right. Look straight. Look up at the ceiling. Up and left, all the way. Keep going. To the right. Better?
Yes.
Head down. Down and left, all the way. Ah, nice. All the way. Better?
Mm-hmm.
Now, for C6, we're going to be here. And we're just getting right under the spinous process, like this. And we just want to lightly lift. So the idea here is we need to lift that segment up. Up. High. A little more. Left ear down. It's tight. You okay?
Mm-hmm.
Right ear down. 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 There you go. Gotcha. A little baby one. But we got it. Sit up straight, please. Taking a couple of nice deep breaths. And out. Deep breaths. And out. Deeper. There you go. One more. And out. Walk for me, please. Let's walk and talk. You're going to walk about 3 times back and forth. Tell me what's different. What's up, Louisa?
I feel like I'm breathing now.
You feel what?
Like breathing.
You're breathing
I
now.
need like kind of like expanded like the chest.
Okay.
That I used to be like this.
How's the back feel?
Back is, oh my god, much better. Especially this mid back here. It's amazing.
Keep walking. Walk on your toes, please. You wear high heels?
Not often, but I do occasionally.
Walk on your heels for me, please. No pain with that, right?
No.
Cool. Have a seat. Let's continue. Good stuff. Ah.
Yes, I cannot believe it. I don't feel that pain anymore.
You can't believe what? Yeah, but let's see what happens. Your homework is going to be very simple but specific. T7 is clear. 6 is clear. Mid back is clear. Ba-da-ba-ba-ba-da-bo. Sacrum is clear. Now let's check the movement again, please. Back slowly towards me. Check it out. All the way back. All the way back. Different.
I don't feel any pain at all.
That's where we're going to start. Can I work on your shoulders, please? Relax there, down. There. Relax there, down. There you go. And now, Louisa, you get the buff and polish. Okay. And let's tune up the feet. Raise your right leg. Ankle. Left leg. Left leg. Turn to the right side. Turn to the left side. Questions, comments, feedback? She's smiling a little bit now.
Yeah, comments is this bump is not painful anymore. And I don't have the bump yet. I
The
think.
bump is gone?
I think so.
Well, I didn't touch up there, did I?
No, I don't know if it's gone or not, but at least
Pain.
I can turn my head left and right, so
Good.
that's a bonus for me. I can clean my house now.
There you go. Center on the chair for me, please. Sit back, look up. Slowly open the jaw, open. So the right side comes out first, open all the way. This is a right AI, right EX. Open all the way, close halfway, hold. Okay, now I have to use the condyle block for the right AI. I'm going to use this just to hold the back of your neck.
Mm-hmm.
Open all the way. As you open, open, open. Slowly start to close. There you go. Gotcha. Yalla. That's the worst of it, okay? I need to do the machine on the TMJ just to... Different. Open. Close. Open. Now the EX. Open all the way. close halfway. There. That's where we're going to start with you, okay? Let's check the hands. Stand up for me, please. Hi. You survived.
I did.
You survived. Squeeze my hand. Squeeze my hand. Good. So the lesson today was what? What was the big lesson? What did you learn about your body and your spine today? Come this way.
I've learned that I have to take care of myself.
What did you learn about your particular issue? Lean in. You're leaning away. Come on. Come on. Relax the hand. Relax the hand. That's it. Did you learn about your foundation today?
Yes.
Do you see how the foundation is so important in the rest of the body?
Yeah.
Everything is connected.
Yeah.
Welcome to the office.
Thank you, doctor.
You're very welcome.
Thanks a lot.
So tell me, this is after your appointment. What is it?
The thing is that I cannot believe that right now I don't feel that severe pain that I felt like years.
Okay.
Honestly, I felt like years, which stressed me out. I was angry. I couldn't sleep. And now, oh my God, I cannot believe that severe pain is gone. Thank you, Doc.
You're welcome.
Thank you so much.